Hi everyone, welcome Dr. Rob Kiltz. How you doing? The Fertile Fireside Chat. It's wintertime in upstate New York. Hello Mrs. Anderson. Hello Jen Katreb. How are you doing? Dream, love, joy. Dream, love. Hello to everyone and welcome another awesome and amazing day in the universe. How, as I often like to say, and today we're full force in the fire. It's full cold out there, and I hunkered down and just hung out and relaxed today. Did a lot of reading, a lot of sharing. I talked to a few people. Although I'm really working to get my Sundays as a day of R&R, and we all must remember we need to rejuvenate, rest and relax, and bring the mind and the body back to its healthy self as much as we can. And it's Miss Sophia, by the way. We got to all keep smiling. The more smiles in life, the better. Remember, when you smile, the vibration of energy, it helps deep within all of us. All right, Michigan, hello. Jen Simis, hello. Oh, and Dr. Luthringer sends his hellos to everyone out there. Let's see, Amanda Holland, hi. Alana, we're going to continue with affordability, giveaways, really working to incorporate a lot of these ideas and energy. Don't forget to go to our website, See My Fertility, and you can download both the Family Building Guide and the Keto Guide. We're coming out with a new Keto Guide, and as you know, Kiltz's keto is primarily carnivore keto, and I've been doing that for 8 years nearly, and really amazing. I feel great, almost 64. The more we take care of the temple, the Ferrari, whatever you choose to call that beautiful and amazing being you. Hey, Natalie, Strange Girl Racing, hi, Elizabeth Ann Munoz. Is it free to download? Yes, the downloads are free for the magazines. The Fertile Secret, I'm working to get out, the new version coming out. You can go to Amazon and get that. Really trying to keep everything as easy to access. And look at our website. There's so much information that you can learn about our recommendation on diet, on help priming and preparing and bettering both the eggs and the sperm. Talk about laparoscopy, hysteroscopy, or endometriosis, inflammation. Talks about fibroids. Talks about so many things. And we got to keep hope alive, by the way, and everything we need to do, Danica, if we need to dig deeper and try to figure out what went wrong, what are the things that we can do better, all right? We're going to do everything we can for everyone. When something doesn't look right, we've all got to open it up, dig deep inside, and look within us. What can we do better? How can we shift and change it? And how could we make each of us feel much more supportive about the process? Because this is a hard, emotional, frustrating journey. You know that. Our emotions just like pile high onto all of us. It was a pretty rockin' busy week. Last week, Dr. Corley's back from vacation. Thank you. Awesome, Dr. Corley. We love you. But a shout out to Dr. Grossman, Dr. Ditkoff, Dr. V, Dr. Fruki, Dr. Chang, but our entire teams. We're working diligently to bring everyone together, help everyone understand how important so much of what we share is on a daily basis. Thyroids. Are your thyroids under control? Get your TSH, T3, T4 levels. Sometimes those TSH levels are normal, but once you start treatment, they go out of whack a little bit. That has a lot to do with just the treatment methods and the medications, but your thyroid is still working. But remember, my belief here is that inflammation going on deep in our bodies is affecting our thyroid glands, our pancreas, our adrenals, and our testicles and ovaries. I know, it's a crazy concept. And yes, Angela's, the keto is kick-ass, king, amazing. Remember, lots of different variations. Marie Emmerich, hello to Maria in Hawaii, and Craig, check out their Carnivore Keto Cookbook. You know me, I'm pretty boring. Bacon, eggs, butter, beef, and ice cream, the baby diet. But Maria's got a lot of really great recipes in here. Ooh, beef pemmican, amazing. We've talked about that for a long time, and really grateful that Maria and Craig Emmerich can go to their websites and look at their cookbooks. They're really amazing, sharing the keto journey, the ideas. Remember, our bodies burn fat, utilize fat for our energy. We must convert glucose and amino acids to fat in the liver. We do not require any sugar or carbs. That's the crazy story, right? All right, so inflammation. Remember, inflammation affects the egg, the sperm, the embryos, and the uterus, the implantation site. We're all highly inflamed. We've been damaged for as many years as we've been alive, plus since we were first created. So it's a crazy concept. All right, let's see. Dimples, I think. What's normal numbers for an AMH and progesterone for a 29-year-old woman, and what to do to make them higher? All right, so typically AMH is at 29 over 2 to 3, but there's a lot of young women with diminished AMHs, low AMH, high FSH, and if you have a diminished AMH or you're not ovulating properly, you're going to have a low progesterone level. So typically after normal ovulation, it should be over 10. That's just naturally. But we've seen Kiltz's keto bring back AMHs. I think acupuncture, massage, DHEA, even human growth hormone can be very helpful. So slow down the body, cool down the body. It's really important. We heat up our body too much. You got to cool it down. Yeah, get out in nature a little bit. Get in a cool soak, but get off the treadmill. It's not good for any of us, by the way. All right. Again, hello to our Instagram and our Facebook. Welcome. Let's see. Hello from Florida. Hell, Chelsea. How you doing? Strong cervix. Okay. So what is good to get a stronger cervix? Keto, really critical. Cool the body down. Remember, all the inflammation in the bowels affects the uterus and the cervix and the vagina and the bladder. All this tissue is adversely affected by high fiber, high carb, low fat diet, and a lot of exercise. That heat, ultimately it damages the cervix. So I think the real critical part is by going keto, and again, Kiltz's keto, I think is critical in slowing down and cooling it down. Don't forget bone broth, and you want to take, we talk a little bit about magnesium supplementation, but the CoQ10, Ovovito, Vasitol, and vitamin D, real critical. But mostly remember, these tissues are becoming lax and damaged due to inflammation. Get rid of alcohol, and certainly tobacco or vaping is not good. So I think those are the main things. Again, what you put in the bowels affects the bucket. The bucket affects the uterus, tubes, cervix, ovaries, and the prostate and the testicles. Again, everything in our body is affected by what we eat. What we eat is not good for most of us, right? Remember, the plants are the predators and we're the prey. They nicely say, come eat me, and we do, and then they damage us and kill us, and they make us fertilizer. The concept is really so simple, but it's hard for us to believe because fruits and vegetables are so good for everyone. My bet is fruits and vegetables are the cause of most of our disease, including cancer, diabetes, heart disease, and infertility. I know, it's nuts, right? Let's see, Taylor, how long are you going to wait? I'm waiting for a list of donor eggs if you got 15. Okay. I don't know how long it takes for these lists, by the way, but everything you can do to help us by bringing your own donor, find a donor out there, we'll help you. There are obviously a lot of people are putting those names on those lists and hoping they get in line. We may be adding a little bit, like if you're really serious, we'll put something down, you pre-buy the eggs, and hopefully we'll get our list moving. But we're looking for more donors. If you know some egg donors, that some young women, 20 to 32 that are interested, please send them your way, our way. Remember, all these things that we do when it comes to egg collection, IVF, surgeries, the emotional and the physical trauma we all go through in this process. So it's not without some challenges. All right, Randy, hello. And let's see here. Thank you very much for everyone's shout out. Austin from South Carolina. Talk about diminished ovarian reserve. Amanda Holland. All right. Women are born with millions of eggs. By the time they hit menopause, they're all gone. They have a time clock on them that we don't really understand. I believe the combination of whatever happened in utero with your mom, and then from what's going on in your body, the ovarian function is being damaged, blood flow, plus lectins, glycans, oxalates, all the things that we eat, micronized, get in our body, the heat and damage to the ovaries are all damaging the ovaries, causing diminished ovarian reserve or diminished ovarian function, polycystic ovarian syndrome. You have all these cysts in the ovary, which I believe are secondary to these plant phytochemicals, plant antigens. And remember, plants are where we get the hormones to make the birth control pill. A high plant-based diet is like taking birth control since before you were born. It's a crazy concept. But I've been talking about this, and it's a hard one to believe. But the hormones that everyone thinks are in the meat are actually coming from the plants that I think damage the ovaries. And it's possible if the functional eggs haven't been severely damaged, the eggs are kind of like hunkering down and they're trying to protect themselves with all this inflammation. If we can reduce the inflammation, we can open up the ability of those eggs and those follicles to mature and be released and hopefully create that child that we all are dreaming of for each and every one of you. So it's really interesting concept. Acupuncture, massage, reduce glucose, get rid of plants, in my opinion. Fruits and vegetables, deadly. Fiber, deadly. High plant-based diet is high plant-based diet. Now remember, a little bit from time to time, cook the plants well, add the fat, a little bit of salt, but get rid of the sweeteners. And remember, my ice cream is meant to be eaten from time to time, not all the time, although it is really good, by the way. But it's a high fat, an egg, and a little bit of sugar, a little bit of vanilla. It's a home run. But we can help the DORs, diminish ovarian reserves. But remember that DOR, when we see sperm diminished morphology, motility, count, all of that is the same causes that cause diminished ovarian reserve. Even likely metabolic syndrome, polycystic ovarian syndrome, is a function in the testicle as it is in the ovary. So this is why eating 3 to 6 meals a day is deadly for this human Ferrari, this human temple. Remember, we're not an amusement park and we're Ferraris, we're not Yugos. We got to take care of this thing better. This is where, remember, some journaling is good, positivity. I'm going to send out a Coffee with Kiltz post later tonight. Hopefully will, or if not tomorrow, we'll get it out there. A lot of it is, remember, you got to have faith in that higher power that's within all of us to get us on this road, to help us reduce the damage within our ovaries and our testicles that affect our fertility. But remember, you might have good eggs and good sperm and a good embryo, but that's where that good environment in the uterus matters. And this is where we talk a lot more about laparoscopy, hysteroscopy, a course of antibiotics. And that course of antibiotics and antifungal, potentially antiviral for 30 to 60 days. I think the 30 days is enough. May help reduce the inflammation going on in the testicles, in the uterus, in the ovaries, that may, again, release the egg and the sperm a little bit better in all of this. But remember that laparoscopy, hysteroscopy, looking for endo. If you don't do the surgery, which has some risks of injury to bowel, bladder, major blood vessel, they're rare enough, thankfully. But the Orlissa or letrozole is another treatment that can be utilized in order to reduce the silent endometriosis that we call it, right? It's silent inflammation. Remember, I feel great, I'm just not having a baby, or I'm having miscarriages, the sperm looks good, the tubes are open, I have regular cycle. That inflammation is the culprit. And endometriosis, I believe, is an infectious inflammatory condition, mostly caused by the bowels, that affects so many women out there, by the way. Jody, keep on it. Chelsea and Ken, hello. And it is an emotional, struggling, hard journey for everyone, by the way. And sometimes even I get a little challenged in the struggles and the pain that you feel. And, some days I hear all the problems. I know I occasionally see the successes, but I don't see them because I'm focused on the problems. And so it gets hard for all of us a little bit. So that's why I do my daily meditation. I visualize and try and practice being more upbeat and more positive each and every day, by the way. All right, let's check out, let's see, Chinese herbs have helped my endometriosis tremendously. Can I continue them during an IUI? Yes, Mrs. Guff. So remember, herbal medicine is ancient medicine. It's a pharmacologic agent. They can be very, very helpful, by the way. From an acupuncturist and herbalist, someone that you trust has some experience in this. But remember, like Western medicine, Eastern medicine, it's not all perfect, by the way. All right, do you recommend Chinese herbs, Alice in Wonderland? Absolutely, I do. But again, from an experienced person. Let's see, Lo Vesperis. How can you make your eggs better quality? So we talked about that. Remember, everything you put in the mind and the mouth affects your body and vibration. You want to visualize beautiful eggs, sperm, and embryos, a beautiful implantation site. That's always the first step. From there, remember, it's the Chinese medicines can help, but make sure you know what you're taking, or the person that's giving them to knows what they're doing, right? You just willy-nilly can't take everything and anything. Cool the body down, get off the treadmill. Tremendous exercise is not good for the bones, the limbs, the body at all. And if you're heating up, making fried eggs and fried sperm, that's not good either, by the way. Kidney disease called cystinuria. I don't absorb the amino acid cysteine. Could this affect my fertility? Absolutely it can. And so, you know, it's interesting, Stag Girl Racing. I've been looking a little bit more at amino acid metabolism. I'm not that knowledgeable on it yet, but certainly there's a lot of amino acid abnormalities that we need to probably be more cognizant of. But any of these are likely metabolically driven, and the disturbances and inflammation may affect them even more and more and more. Likely we need very little of the amino acids. We need a lot of fat. We need no carbohydrates. That's the amazing, crazy story to all this, by the way, is that our bodies are fat-making, fat-burning machine. We don't burn glucose. You must convert glucose to fat. That's the simple story. All right. Hey, Joyce Valdivia, how you doing? Let's see, Taylor, donor eggs, how long do you have to wait on a waiting list? I don't know the time limit on that. Listen, get on the list, keep looking for donors. We have frozen eggs, frozen embryos. We're really working to get more donors through the process, by the way. Hello, Melanie. All right. Zendia, do you suggest fresh or frozen? Jennifer Lynn Howard, good question. Fresh or frozen transfer? I think both work. We do a lot of fresh, we do a lot of frozen. If your estrogen is super high or progesterone super high before you or when you trigger, then a frozen may be better. But that said as long as your progesterone by trigger is around 2 or less, your estrogen levels are under 3,000 to 4,000, then putting back one embryo on average, occasionally 2, may be beneficial. I think we need to look more at fresh transfers, day 3, day 5 and 6, more immune protocols. And don't forget, we're putting up the immune protocol 1, 2, 3, and 4. 4 is the big guns, IVIG, Humira. The 1 is a low-dose steroid, low-dose antibiotic. And don't forget, it's always LDN, CBD, and Kiltz's keto is the cure. Now, when Kiltz's keto, remember, I primarily focus on carnivore, but as a vegan and vegetarian, simply cook your carbs well, eat once a day, and add either coconut fat, or hemp oil. And for the vegetarians, it's ghee and cream. How's everyone doing? I got to make sure I smile. Sophia said, I don't smile. So if you're noticing I'm not smiling, please, it's in there. You know, my vibration is a smile every day. And I'm really grateful for the loves, the support, the shout out from everyone, by the way, and enjoying bringing lots more support to everyone. And if you're enjoying the football game, if there is one, I'm not much of a follower of football anymore. I used to follow a lot, but it's been a long time. If you're enjoying it, please remember, tell the football watchers that we are on recorded later, so they can check it out later tonight or tomorrow. Let's see, 4 months later, I'm pregnant, currently 24 weeks. And remember, once you get pregnant on keto, stay keto. Keto, paleo, I think is the way to go. And remember, there is vegan, vegetarian, standard, all over the board, by the way. I support everyone in the process. I just want us to better understand that plants contain all the poisons that are likely doing all the damage to us. All right, progesterone levels were good at transfer. Do you need ERA after a failed transfer? Okay, endometrial receptivity assay testing, ERA, it's a biopsy where it would be the day of a transfer on whatever you would be on for the standard transfer, which will tell us the window of transfer. I'm not convinced. Maybe everyone should get it or no one should get it. So we don't always have the absolute answers in this medical field, unfortunately, which is really hard for me, but it's what it is. And so I think it can be helpful. Again, intralipids, ERA, hysteroscopy, laparoscopy, all can be helpful in the process. Which is the one you that works? It's the one that works. If what you're doing didn't work, then we should change it up. And a lot of the nursing team has the sort of the list at hand, and you wonder, why don't we start with level 4? Why do we start with level 1? That's a good question. A lot of what we work to do in this field and medicine in general is less often is best. That's where we like to start off, I think. Georgia location, Smurfy, how you doing? We're working on Georgia. We're working on getting the whole Georgia team up to speed on a lot of this stuff, and getting Dr. V trained. Maybe Dr. C, Dr. Corley can help down there. Really excited about lots going on. We're really working on getting our Buffalo open and working on a few other things. We've been talking about it. But remember, a lot of what we're sharing here are ways for everyone to get their mind and their body in shape for that fertile system, that it can work properly, right? And that when you go to do, whether you're doing intercourse and having sex alone, or you're doing IUI or IVF or donor eggs or whatever it is, we want to do everything we can to support it and get the very best outcomes. It's a hard one when it's not working, where we go like, I don't know. But ultimately, remember, it's inflammation. And when you got to go all the way to my crazy Kiltz's carnivore keto, that might be it. But again, lots and lots to go. Donor medications, whatever you guys are doing out there, it's you're in charge. Let's see. Hi, Heather Greenwood. Let's see. Both tubes work, but sadly we lost both pregnancies. What is likely that our next pregnancy will end in a loss? Hey, Brandy, sorry for those losses. And remember, not getting pregnant and early losses and later losses are all really surrounding about the same cause. It's all acute and chronic inflammation. But it's the keep going, don't give up. I don't know which one is going to be the one to work, but whatever you do one of them, and we're going to help get you there, by the way. All right, let's see. Melanie Parker, trying to conceive over 2 years, 40 years old, no baby, starting to think it's not going to happen for us. All right, we all have the worry gene, don't we? We want to be the wanderer gene and the dreamer gene and hold that dream, don't let it go. That's called faith. When you hold faith, even though it's sometimes hard, we get off the track, but we got to pull ourselves back. We weave in and out, and this is why I like to read and write and meditate and focus on that for myself. But there's still an awesome chance. Don't give up. Remember, whether it's your eggs, donor eggs, partner sperm, donor embryo, adoption, or finding joy and happiness in what it is, that's our biggest challenge in life. None of us can promise the outcomes, but we're all working in the same way to help increase the chances for that outcome to occur. All right. Hey, let's see here. Let me switch over. Premature ovarian failure protocol. All right. So this is where a month of estrogen, the birth control pill, low dose testosterone. So by suppressing the LH and FSH in the brain, and then hitting it hard with a high dose gonadotropin dosing might be good. But don't forget, we are looking at PRP ovarian injections, intrauterine high dose, high volume PRP, and don't forget my diet. I'm telling you, this is the game changer, in my opinion, for the human health. I've seen diabetes gone, hypertension gone, colitis, Crohn's, irritable bowel gone. It's amazing. And I've seen AMHs go up and ovarian function reserve come back. Don't forget acupuncture, massage, and visualization. Smiles, right? Keep the smiles going, everyone. All right. Hello from Tampa, Colleen. All right. First Sona tomorrow. All right. We're praying, everyone, by the way. And we got to all keep the prayers flowing to the universe, to our to all of those on this journey of fertility. We all have to hold it strong, right? All right, suggest taking turmeric for inflammation. I'm not a big turmeric fan, but a little bit maybe okay. This is where I think keto is better. LDN, CBD oil, I think is good, and slow it down. Those are the things that I think are better. Check your vitamin D levels in the process. And it may be worth, of course, a month of antibiotics, antifungal, antiviral, by the way. But let's see. Hello, Heather Bellinger, Little Mama joined. Hello. All right, I'm kind of flipping through a little bit, everyone. Thank you. Day 5, let's see. If Day 5 stems, I already have 40 follicles. Will I have more by retrieval? Let's see. 40 is a lot. You're going to do well. You could have more. You could have less. No one knows how many are going to be mature. But remember, looper on trigger. All right. How are we doing, everyone? Hello, Dr. Corley. How you doing? Great team. So grateful to everyone, by the way. Theralogics, Ovavite, Ovasitol, omega-3 fatty acids. But remember, my ice cream is full cream, and dip your steak in butter, by the way. Acupuncture, highly recommended, by the way. And all of us need to work together. Sometimes we're angry, we're mad, we're frustrated. We share the words, we write it down. We're all here to listen. And then we have to imagine, all right, how do we fix today for tomorrow in the process and get the outcomes that we all desire, by the way. All right. Thoughts on NPLAF procedure? Maybe. I've looked a little bit about it, Yulia, and I need to look more at it for sure, but would certainly, and this is where, again, the PRP intraovarian is useful, I think. Hello, Katie Miller. How you doing? Let's see. First egg in the morning. Decided. What can I expect with the process of decisions after this? So, all right. Egg retrieval. Traveling from wherever in the country or the world to Syracuse, Albany currently. It's a little frigid here, so remember to come early and go slow. And go slow on those roads. For sure, but you're going to come in, you're going to check into the front desk. Danielle and Amber and a whole host of really great people at the front desk, really helpful. Come in the healing arts side or the front fertility side. They're going to get you checked in. They're going to usually put you in a private little spot to go over the consents and make sure everything is understood. And then the nurses are going to meet and greet with you, bring you back to the retrieval space. You're going to get changed into a robe. We're going to introduce you to the nursing team, to the anesthesiologist, put an IV in you, get you all settled in, get you sedated for just about 5 minutes, do a brief egg retrieval. In Syracuse, it's either myself, Dr. Corley, or Dr. Lutheringer. Literally, it takes 5 to 10 minutes, really easy, generally safe and low-risk procedure. and then you'll wake up and wonder, have you gotten started? You'll know how many eggs. We'll talk about whether we're going to do a fresh transfer or frozen. If you're doing PGS testing, we'll go over that. I'm not a big fan of PGS testing, but if you're looking for gender and you're doing it for other genetic diseases, we offer it wholeheartedly, by the way. And then once you're all recovered, get you back dressed, bring you back to your recovery space, and then with your partner, whoever you're with, will help you get out to your car or your transportation, going home to one of the local hotels. And then the next day, you'll hear how many you fertilized, and we'll give you the timing for that transfer, whether we're going to do a fresh, a frozen cycle, and more instructions from there. There's so much information to throw at everyone. You know that, right? And I'm working on, Amber's doing a video right now for those going through an egg retrieval. She's a donor right now, but it really is going to give you some good information for everyone. So we're hoping to get that out there for everyone. But it is kind of scary, if you haven't done this before, if you've done it, even if it all went great, there's still a lot of newness to the process, and we want to try to help people get through it as best as possible. All right. Queria Keel. How can I naturally get my period to start if it doesn't come when we do Provera? I've taken it before and it worked for me, but when should I ask her how long? Okay, so listen, if you're not getting your period regularly and the Provera doesn't work, it's a good idea to get an ultrasound and some blood work to look at pregnancy tests, estrogen levels, FSH levels, maybe even an AMH, look at a thyroid level and a prolactin. Those are helpful in the process. Sometimes you have a thin lining, you take the Provera, you're not going to menstruate. Many PCO women have thin linings, they don't have high estrogens, it's low, so they don't need to do the Provera. They can just go ahead and get started with either Clomid or Letrozole. We primarily use Letrozole. Or go ahead and get started on your estrogen if you're doing a frozen, or your injectables with either Gonal-f, Follistim, or Menopur, by the way. So again, there's a lot of different ways to do this. Do an ultrasound and blood work is an easy way to know what's going on within. Low progesterone, Caitlin. So low progesterones, remember we're adding either vaginal or intramuscular. There's a new subcutaneous supposedly coming out pretty soon, or the Prometrium oral, by the way. But if you ovulate, and you get your progesterone is going to be a little bit higher than if you're just doing these medications. So if you're doing estrogen and then either oral or vaginal progesterone, the levels may be lower, even though the local levels may be a little higher because of the vaginal route, by the way. All right. Hello, Dream Love. 92 pounds, how you doing? When are intralipids recommended? Allison Wonderland. So basically, the intralipids can be utilized for everyone. It really is a help reduce inflammation, and maybe once a week, every 2 weeks, or once a month. The same might even be with PRP intrauterine, by the way. We've been talking about that with Dr. Verdialis, who's helping us with that. But basic intralipids can be started. Hey, I'm infertile. What do I do? I'm talking to Kathy Walker down in Atlanta, TK H2O infusion, about intravenous support with amino acids and vitamins, glutathione and other substances, intralipids, to help boost both the egg, the embryo implantation. We might likely talk more about this for guys. Remember, that sperm count may look normal, or if it is abnormal, what can we do? Guys, get off alcohol, slow it down, cool it down. Remember that. And remember, Kiltz is keto, real important, but maybe a monthly infusion of some fluids, electrolytes, some antioxidants, and some intralipids may all be helpful. Don't forget CBD, LDN. I think it's helpful too, by the way. And guys, Conception XR and the Ovasitol, I think, are good because we all have metabolic syndrome. Remember, metabolic syndrome is prediabetes. That's the inflammation. Glucose causes glycation, which damages all of us. it may be as simple. That's why adding the fat to a standard diet, which makes it more paleo. Remember, if you add fat, you lower sugar, carbs. The amino acids, proteins are always about the same. And I've seen this stuff really, really, really work. So I think intralipids, we should probably be talking about that much more commonly. Do more infusions, can be really, really helpful. All right, LDN throughout pregnancy, benefits and safety. Jen Kedren. I think LDN throughout pregnancy is healthy and safe. If you look at Boyle in Ireland on LDN, Phil Boyle, he's been using it for years. I think it's a very safe medication. It's compounded. It's Narcan, naloxone, very small minor doses. They seem to reduce inflammation. If you Google the LDN book, start reading about it. I think it's very helpful and throughout pregnancy. Let's see, keto ice cream safe with raw eggs. All right. I think raw eggs are safe. Obviously, there's many more things, and we're seeing more lettuce recalled than ever an egg recalled. So I don't know where this egg thing, but you don't need to put my egg in the ice cream if you're worried about it. By the way, salad's more deadly than an egg, I bet. Let's see. Would you recommend it for a guy before egg retrieval? She'll see. If this is regarding sperm, like everything we've talked about, we certainly want to improve the sperm. An ejaculation the day prior to the egg retrieval is okay. It seems that more ejaculations may help the sperm do better, but everyone be more supportive in this, listen and learn together, and ask questions. And we're here for those questions, by the way. And tomorrow, Syracuse and Albany are going to be very crowded and busy. So thank you for patience, by the way. Laparoscopy, hysteroscopy, Maggie Hardy. Endometriosis, or looking for scar tissue, endometriosis, intra-abdominal pelvic. The laparoscopy is a surgical procedure through the belly button, asleep, to look for scar tissue and endo to either excise it, vaporize it, or cut it out, basically. I think it can be very helpful for those who don't get pregnant naturally, those who have miscarriages, those who have failed IVF or IUI. All these procedures have some rare and minor risk of injured bowel bladder, major blood vessel, failure to find the problem or fix it, and possibly scar tissue coming back. But in general, the benefits outweigh the risk to this procedure, by the way. And so another way, instead of the laparoscopy, hysteroscopy, is think about a month of Orlissa, letrozole, and possibly an antibiotic at the same time. But I think they can be helpful. The laparoscopy, the hysteroscopy is looking through the cervix into the uterine cavity for polyps or small fibroids or scar tissue that can be removed. And sometimes doing a general cleaning out will also help get the uterine lining regrowing and increase its stickiness and increase your chances for conception. So the hysteroscopy and laparoscopy can be done in our office in Syracuse. Hysteroscopy can be done in both our offices, but the laparoscopy in general is an outpatient, 1 hour procedure or less. Occasionally we'll find something on diagnostic surgery that it's like, oh my God, you have a big fibroid, we got to get you back for surgery at another time. But in general, we can take care of most of those things at the same time. It's a couple of days of recovery to a week, back to work in a day or 2 or 3. If we found a lot, sometimes a lot of endo, we might treat you with Lupron or Orlissa for 30 to 60 days plus letrozole. But all these things can help significantly. Let's see. Ask for the Provera, Kira. Again, back to the, are you bleeding or not? If you're not bleeding and you take the Provera, ask the nurses about it. If you haven't had a period, but I always say get an ultrasound and some blood work. Let's see what's going on. If you have a thickened lining and a low progesterone, take the Provera. If you don't, then don't need to take it. Hello, Nicole Fairbanks. How you doing? Kristen, hello. Let's see. Very scared of ovarian torsion. How easily can it happen if I have 40 follicles? Ovarian torsion is extremely, extremely rare. In the 30 years I've been doing this, it really is less than a handful. It's very, very uncommon, by the way. A simple cyst that you had that had nothing to do with this stimulation process is more common. All right. Mrs. China Doll, how you doing? Occasionally we can do 2 embryos. The question was, can you do 2 embryos for embryo transfer? It can be from time to time. We individualize that, by the way. I'm working on, Lahorn 23, Buffalo is not ready yet. We're waiting for our gas lines to be hooked up. We had to get a permit and get a generator in. It's there. Dr. Chang is there. So I'm hoping by March, all that's going to be in place. So it's coming very, very soon, by the way. What do you recommend in determining how much the lack of cysteine absorption? I asked that one. I don't know that answer, but I think all those metabolic disorders are very important in this process and affect implantation. Again, back to metabolic syndrome, diabetes, which is a high inflammatory disorder. All right, what test do you recommend? My OB 29, never been pregnant. My cycles are like clockwork and I ovulate on my own using sperm donor. All right, I think the dye test is helpful, hysterosalpingogram. I think it's good to look at your basic metabolic panel, blood count, blood type, NRH, just some baselines. You might want to do genetic testing. It's available of your blood to see if you carry any genetic disorders. And really, those are the main things. Check your vitamin D, thyroid, prolactin. Those should be all you need, but technically, you don't need anything. Do the IUIs. If it works, great, but you spend a lot of money on donor sperm, and if it doesn't work, and then you find out my tubes are blocked, or maybe I'm not ovulating, so checking an AMH and these things could be helpful. But at 29, you can even, plenty of people are doing home inseminations, and it works very nicely without any intervention by a doctor. Can you imagine that? Not seeing a doctor. Yeah. All right, Martinez, Heather or Ann, how you doing? A pleasure, and thank you to everyone, by the way. Atlanta doing IVF soon. Key 2008. Not quite too soon. I'm working on it later in the year, probably next year, but we are working towards that. Dr. V's working on her training. Dr. Lutheran's got his training already, doing awesome, but we're working on that. I know we've thrown so much at so many people in this CNY fertility craziness, affordability, quality access. We want to involve you in your care and help us. Know what your labs are. Get your prolactin, your thyroid, your AMH. Get your records and get them in your hands. Review them so you know what they are before you get started. So that, it can't fall all on us because we really want to work as a team together. Now you can get all your records. We should put a simple record list together. What is your blood type? Have you had your vaccinations? Do you know what your rubella is? Your blood type, your RH, your AMH, your FSH. What's your sperm count? I mean, these should be so easy for all of us to get and have access right on our own devices, right? So that's really, I think, critical for all of us. All right. MTHFR. Let's see. Alice in Wonderland. So, again, another likely metabolic disorder, right? It's all part of the metabolic processing of amino acids and folate, which affects blood flow, blood coagulation, and many other factors. And so typically we're adding methylfolate. This is where I think the keto diet is a home run. Take your supplements. This is where a steroid, aspirin, and Lovenox may come in helpful to reduce the blood clotting. But remember, the plants contain the phytohemagglutinin. They contain the chemicals that cause blood clots because plants want to kill us so that we die and become fertilizer. It's as simple as that. or they want us to plant them everywhere and help them survive everywhere. Crazy, right? I know. PGS testing for gender selection. Gius Bartolota. Yes, we do PGS testing for gender. Day 5 and 6 embryos are biopsied. Again, we can't guarantee you'll get embryos to biopsy, you'll get the gender you want, or you might have the gender but an abnormal embryo. Remember, a biopsy of an embryo may be biopsying some cells that say they're abnormal, but the rest of the embryo and the fetus inside is normal. It's not 100% accurate. They probably would have thrown me out if they tested me before I got into my mom, right? Let's see. Endocrinologist turned hypothyroidism into hyperthyroidism, says has no effect on pregnancy and will help me in long run. Any thoughts on? Both of these things, too high, too low, may be a factor. There is a window. It probably is wider than the one we're looking at and using, that 2.5 TSH. Probably could be a little higher, certainly a little lower. I think that we're throwing too many drugs at each of us. Remember, the plants contain the drugs also, because plants are the phytochemicals that are probably screwing up all of our numbers. And then we're like, well, it's going everywhere and we can't figure it out. But the fact is, it's in the drugs we use, it's in the plants we eat. That's the nutty part about it. All right, Kristen, Bessie, hello and thank you. God bless to everyone. And we are working diligently to do all our very best as human beings, to do all the right things for everyone. And certainly if any untoward effects happen to anyone, we are here to try to work and help us get through it. So this is not easy. Between not fertilizing, not getting embryos to transfer, not getting pregnant, or getting hyperstimulated or understimulated, all of these things, unfortunately, are part of the crazy journey. I know, nuts, right? All right, Tamara, how you doing? Fedrug, how you doing? Tests on the eggs are still okay. I'm 43, want to freeze. Shannon, Drake, hello. Yes, so we could still freeze eggs at 43. The data is hard to know what it means. If you have a higher AMH and better egg function, it may be worth it. No one can say it was a fault to do it, but in many cases, those eggs may never make a baby. But how do we look at life? All right, half full, half empty. You choose. Probably tells us a lot about each of us, right? All right, natural pregnancy, baby stopped growing at 6 weeks. Heartbeat stopped at 8. Same with mini IVF. I did testing of the DNC tissue, came back with no indication, and he was thinking about coming. So Annie Marie, this certainly has a lot to do with inflammation. Those egg, sperm, and embryos are normal. We talk about silent endometriosis. Remember, the keto diet is a home run. I've seen so many on Kiltz's keto. The baby diet, bacon, eggs, butter, beef, and ice cream. Yes, ice cream from time to time, not all the time. Intermittent feasting. Intermittently eat once a day at night. We call it fasting, but if you intermittently fast, that means you're intermittently not eating, and really what we want to do is intermittently eat once a day at most, in my opinion. But certainly there's a lot of help there for miscarriages, failed implantation, not getting pregnant, by the way. All right. Let's see. How are we doing here, everyone? Med things. Let's see. Just 111409. Could you talk about meds or things we can add to a cycle after RPL if we're already done level 3? All right. Level 4. Humira, IVIG, and LIT. Leukocyte aminotransfusion. Mike Vero in Markham Fertility in Toronto is awesome. They do the LIT in the Canada side. Otherwise, you go to Nogales, Mexico for LIT. It's a weird one. It's the guy's white blood cells injected under the girl's skin. It's basically a treatment for allergies. It's allergy treatments. I think it helps. But don't forget Plaquenil, Prograf, Neupogen, human growth hormone. I'm going down the list. Weekly intralipids, monthly IVIG, and potentially monthly Humira. And don't forget my crazy diet. I know it seems like it doesn't make sense. And don't forget Miss Maria and Craig Emmerich. We got to give them a shout out. Go onto their website, say hi from Dr. K. We're all on this crazy journey. The crazy books I read: Poisoning by Plants, Mycotoxins, and Related Toxins. This is the crazy stuff that I find that if animals are dying from it, why can't humans be damaged and dying from the same thing? But it's all pretty amazing and interesting. I love to read The Human Hunter-Gatherer Diet by Brock and Diggs. Really, really amazing stuff. All right, how are we doing here? Time-wise, 10 more minutes. All right. So again, I'm going to make sure Will puts that on in our family building guide online, so you can download that list for sure. And don't forget laparoscopy, hysteroscopy if you haven't had it. The month of Orlisol, letrozole can help, and the full immune 4 protocol. Do you see less success having to be on estrase longer in an FET cycle? It may be Alexin Colorson. So if it takes longer for estrogen to thicken the lining, you have damaged endometrium. This is where PRP, maybe weekly, may be helpful, where my diet may be helpful. I think it can be really, really, really great in this process. So yes, the longer you take it to get the lining, but if your lining develops and you take a little bit longer, most of the time if it develops like a nice lining with no defects at all, I think that it's not a factor. But I think the longer it takes, it's an indication of some defective endometrial function. This is where Viagra may come into play, either vaginal or oral, where acupuncture, massage. Remember, slow it down, cool it down, get off the treadmill, by the way. All right. It's a blood thinner. And don't forget, the foods we eat can thicken the blood or thin the blood. And it's mostly plant-based, and it's nutty. But I'm sticking to this one, by the way. Tubal ligation, how successful is it? Previously had 3 full-time pregnancies. Tubal was 6 years ago. Gladdy 83. We do tubal reversals. We've had good success. If it fails, you can do an IVF. But if you've had clips or bands or minimal cautery, I think it can be a successful procedure. Lovadox is a blood thinner, by the way. And heparin can be used also as another blood thinner. All right, how we doing, everyone? Thank you for being so patient and enjoying tonight. Say hi to all the football watchers tonight from me. And I know the Super Bowl's coming on soon. Not tonight, but all excited about wherever you guys are watching. But kind of like, you got to be here tonight, right? This is where you're going to learn all the really good stuff. All right. And thank you, Elizabeth Lee, for the shout out. Let's see, Mary Mitchell. And you guys share the keto stuff you guys are eating. Miss Marnie made this fat bomb with some chocolate chips in it. You guys know I do salami, cheese, a little bit of chocolate. Occasionally we'll take the top off that pizza, a little bit of cheese and pepperoni. I did have a bite of that pizza the other day. We did our ACL's refresher course, and oh, that was good. But it was just one bite, by the way. Let's see. Keep your mind. Let's see. How do you keep your mind off not eating? It's not easy to not eat, even for me. I'm hanging out today at the house all day. Let's see. I had a little bit of salami and cheese. I had a little bit of my ice cream as a snack about noon today. And then dinner was a small cap ribeye with some butter, and then another little cup. Miss Tia made that great ribeye for me. It's always delicious and amazing. But I'm the boring eater. I eat the same thing almost every single day. I know it seems crazy, but it's been amazing for me. My irritable bowel and bleeding is gone. My psoriasis, eczema is gone. My migraines are gone. I know I still sound a little crazy, don't I? Right? All right. Am I smiling? Sophia? All right. How's everyone doing? Carly, how you doing? And share these concepts. Encourage your friends to look at this. Look at keto. Our magazine, Kiltz Keto. I'm calling it cure, but Google doesn't like cure, so we're calling about health and wellness. That's it. It's all about health and wellness. The more you're healthy in the mind and the body, the more you're fertile. And that's what we're sharing here. Our hopes are that suddenly, hey, Dr. Kiltz, we're pregnant. Hey, CMY Fertility, we had a baby naturally. We're striving for natural health and wellness, and I've seen it for myself. I did about 2 weeks of exercise over about a month ago. Injured shoulder, injured hips. I'm back to just taking it slow and easy. I move a lot at work, and it's through that movement that probably is the key for all of us. Lady Diane, how you doing? Thanks for your words. Hi, Christina Morris Seals. Let's see. What's the criteria for transferring 2 embryos? Hannah. All right, over 35, multiple failed cycles, poor quality embryos. There's some guidelines. If you have PGS normal tested embryos, you get 1, 99% of the time. But we'll individualize it. If it's day 3 embryos, you may be more likely to be able to get 2. If it's day 5 or 6 embryos, then we're more likely to do 1. But connect with us. We'll discuss those individually. By the way, and I'll take down the SART ASRM guidelines and I'll bring it on for us next time. Hey, Jen Loveless again. Sandra Alex Walker, hello. Nutrients. All right. So we are a fat-making, fat-storing machine, and that's where the nutrients are. The concepts of eating 3 to 6 times a day is wrong, Steph. We got it all wrong. We're built to go days, if not weeks, without food, but a day or 2 without water, and only 3 minutes without air at best. If you look at nature, how they go days and days and days, and sometimes weeks and months without ever eating, we have been brainwashed into our nutrients, and nutritionists in general are giving us a lot of incorrect information. That's the crazy part. Minerals and vitamins are packed in red meat for sure, and in most meat it contains it. You got to eat the fat, by the way. That's the amazing thing. But eat less. That's the trick to this. And fasting is the healthiest thing you'll ever do. Intermittent feasting is even better. It's hard to fast like 1 day a week. Like I do it, I don't eat until night. 99% of the time. Very little snack at lunch, if anything, but it's a little piece of salami and 1 little piece of chocolate, but that's rare. All right, how we doing? Everyone doing great? And thank you, Jen Carroll, and a shout out to everyone. This pregnancy, I was 120 pounds and now 170, no morning sickness, which is good for me, gained. Listen, remember, when you're gaining weight and getting fat on your body is survival. We need that, by the way. And animals out in nature, they don't get fat, they die. We humans are meant to get fat. The healthy genes are those that get fat. And if you're skinny and can't get fat, that might not have been a survival gene in the past. But since we have plenty of food, it's a crazy one. I'll go nuts on this one. All right, we're closing down here. It's just a few more minutes left. Let's see. Vitamins, the Conception XR for guys and the Ovavite for gals. 4 days. Living a 4 to 6 day fast is great. But in general, just eat once a day. It's a lot less. And if you go Kiltz Keto or Emery Keto, you'll feel amazing, by the way. All those diseases gone. And just ask your doctor. He's probably going to say that keto is dangerous. And remember, kidney stones are caused by oxalates that come from vegetables, not from meat. Same with what am I thinking? Diabetes for sure comes from eating salad. I know it's crazy. All right. Thank you to everyone. I'll see you next week. I'll see you this week. Patience. Bring a book, something to read, something to listen to, something to watch. It takes time to give the care that we're really working to give for so many. So God bless. I'll see you guys next week. Dr. Rob Kiltz on the Fertile Fireside Chat. See ya. Bye, everyone.